Thank you for your interest in our Quicklear ceramic bracket system. The Quicklear bracket is a self-ligating, translucent ceramic bracket which complements the BioQuick bracket system as an aesthetic alternative. The newly created ceramic mixture matches the patient's natural tooth shade perfectly. The initially passive and later in treatment active clip made of chromium cobalt features stops. A snap function on the clip and bracket makes it easy to open the interactive clip from the gingival. Rounded slot and clip edges combined with a smooth surface guarantee controlled tooth movements with minimal friction. The 4 contact ribs in the slot allow free movement of the arch wire, especially in clinical situations requiring strong vertical arch wire movements such as lifted canines. Traditional bracket slots show heavy binding and notching effects. Thus, the movement of the arch wire within the slot is restricted, which in turn delays the alignment of the displaced canines. Through the 4 contact ribs in the slot of the Quicklear brackets, the arch wire only rests on 2 contact points. This guarantees free movement of the arch wire with minimal friction. An occluso-gingival edge on the bracket base prevents excessive adhesive flowing into the clip mechanism when positioning the brackets. The newly developed inverse hook-style base with diametrically offset retaining holes provides purely mechanical retention on teeth and trouble-free debonding following treatment. To secure a good mechanical retention, please carefully brush primer in both directions into the retention cavities on the bracket base. It is recommended to place the bracket contacting the tooth at the gingival aspect first, then pushing excess adhesive towards the occlusal surface. An occluso-gingival edge on the bracket base simplifies the removal of excessive adhesive. Please use the Quick Explorer by ForestaDent to open the clip. The clip can easily be opened from gingival margin by using the Explorer. To do so, slide the probe along the pad margin until it engages in the notch. The notch on the pad margin automatically guides the probe to the clip. It can now be easily opened occlusally by applying light pressure. We recommend supporting the thumbs on the incisal edges to control the force and movement for opening the clip. Alternatively, the clip can also be opened from vestibular. Due to the usually strong plaque accumulation, we recommend to open the lower front from the gingival aspect in order to prevent any deformation of the clip. Do not use a rotational movement or apply excessive force to open the clip, as this may result in deforming or breaking the clip. It is recommended to clean the bracket before changing the arch wire in order to remove plaque accumulation and maintain the flexibility of the clip. The precisely rounded slot edges even allow the use of tooth shade coated arch wires. To achieve perfect aesthetics, we recommend the use and regular replacement of tooth shade coated Titanol cosmetic or biocosmetic arch wires. They should not be bent, as this may damage their coating. The clip remains passive up to 16 by 22 or 18 by 18, as it allows free movement, which guarantees faster treatment time. The clip becomes increasingly active once the arch wire dimension increases beyond 18 by 18 or 16 by 22 to ideally transmit torque and angulation. Full wire engagement and a fully active clip is achieved by inserting an 18 by 25 arch wire in an 018 slot or a 22 by 25 arch wire in a 022 slot. That ensures the transfer of virtually all the preset values in each bracket. Please make sure that the arch wire is pushed into the bracket slot deeply by using a director and hold until the clip is closed. Rectangular arch wires can only be used after finishing the leveling phase, otherwise it might cause damage to the clip. For splinter-proof debonding of the Quicklear bracket, hold the pulls tool parallel to the occlusal plane and place the 2 vertical rips of the tool at the mesiodistal sides of the bracket. Then push the end of the tool distally. Alternatively, a modified debonding plier with notch can be used. Position the plier on the mesiodistal beveled edges on the bracket base and squeeze the plier. Using the debonding tools by ForestaDent correctly guarantees an easy and splinter-proof debonding of the Quicklear ceramic bracket due to the designed separating line at the bracket base. In this way, enamel chipping is prevented as a large amount of adhesive remains on tooth, which can be removed with the help of a burr. Therefore, the removal of the Quicklear ceramic bracket is not painful for the patient, as the use of a diamond cutter is not necessary. Try the Quicklear ceramic bracket system and benefit from reduced chairside time, faster treatment success, and satisfied patients.